Just drop. Give me the weight. Good. Awesome. There we go. How was that? You okay?
That's great, yeah.
Good. Hey, Freddie.
Hey.
Thanks for coming in today.
Thank you for having me.
Freddie is a genuinely new patient who's seeking a little bit of musculoskeletal care for a condition that he's been struggling with for quite a while. I'm going to let him kind of take us through what he's been through so far, what he thinks is going on, and then we can jump on in. So, Freddie,
Sure.
why don't you go ahead?
Thanks, Adam. So, my name is Freddie Redding, owner and founder of DetailGuys.ca. We're essentially like a mobile auto detailing business. I've been doing detailing professionally for roughly about 7 years. Detailing is a very intense, physical, laborious job. And for the most part, I've never really felt a lot of pain in my back up until the beginning of this year. Reason being is I used to smoke quite a bit, and when I quit earlier this year, I suddenly started feeling a lot more pain in my back, and I thought it was just a transitory period of getting off any smoking, right? But what happened was after about 3-4 weeks, I noticed the pain was still there. It was in my lower spine, and I inquired with my doctor. So we ended up proceeding a requisition to get an MRI done. Took about 8 weeks to get that done. Finally got the MRI done. We got the results. Adam here was pretty happy to have a look at them as well today before the session. And turns out I have a compressed disc on my L5 spine. So I'm excited to see what we can learn today and what we can do to hopefully resolve and maybe fix that to some extent today. So
well, that was pretty thorough, which saves me some work. So, but anytime we're dealing with a compressed disc, that's a degenerative change, and there are things that we can do to kind of backpedal on the symptomatology that we can get with degeneration. As for reversing degeneration itself, very difficult, if not outright impossible to do. But I really do need to stress that just because the degeneration is there and just because the compression is there doesn't mean that the associated symptoms you've been dealing with, by the way, Freddie has mentioned off camera that he is getting some pain down, I believe it's his left leg.
Yeah.
We can alleviate that. And at the end of the day, that's where I believe your primary concern is the issues that arise as a result of the degeneration rather than the degeneration itself, right?
I would agree.
Yeah, so perfect. So for today, we're going to be doing a low back screening, absolutely. And then I know that, again, he mentioned that he works a rather physically intense job, so I'm imagining that he's going to have a lot of tension kind of everywhere else in his body. Now, did you mention headaches or upper back or neck pain when we last spoke as well when we were booking this appointment? I think you did, but that seems like it was a while ago.
Yeah, it's mild. It is mild. This morning I wake up with head pains. The thing about being a remote kind of mobile service that we offer, it's tough, and I need to get better at it, is to just drink water and stay hydrated. So part of that, to be honest with you, is probably a lack of dehydration.
Lack of hydration. Yeah, not only so a little bit of lifestyle modification as well. The things that I do in here can definitely help in the moment, but the most important thing is that you're either doing the exercises that I prescribed or you're making lifestyle modifications, whether or not that's an ergonomic change or a dietary supplement or whatever it is, because that's the thing that, let's pretend I wasn't available tomorrow, I wasn't available going forward, you'd be able to at least take care of yourself to a good degree from there. So, so for today, we'll do a full screening, low back. You said you have headaches. You think it's due to dehydration. Let's confirm anyways. Neck exam with the headaches. It could be dehydration. It could also be just due to general tightness. So let's find out. Can you get you to bring your chin down to your chest for me as far as you can? Any discomfort in the back as you do that? Because I'm noticing you're not getting pretty far.
It's tight.
It's tight. Okay,
Yeah,
when
tight.
I go ahead and do this, worse on the tightness?
It is, yeah.
Okay, you're going to come back up. Look up to the ceiling for me. That's okay?
That's fine.
That's fine. All right. Why don't you bring this here down to the shoulder? Good. That's okay?
Yep. It's tight, but
Tight?
there's no.
Here, shoulder.
Yep.
Yep. You got a little bit more that direction, it seems. Good. I want you to rotate your head this way, check your blind spot. We're getting to about 70 degrees on to the right and go to the left. And we're getting 45 degrees on the left. So we're getting a significant decrease between the two sides there. There could be an effect of the neck tightness contributing to headaches, because that's very common. We call that a cervicogenic headache, and in some cases also a tension type headache if it's purely muscular. So that's that. I'm going to get you to next stand up for me.
Sure.
And I want you to rotate 90 degrees. Take one step forward, one small step forward. Rotate to your left, 90 degrees. or like turn yourself to the
right.
left 90 degrees, my bad. And I want you to bend down, touch your toes for me as best you can, okay? Good. Now, any discomfort in the low back as you bend forward like that?
It's more actually in my hamstrings, my calves.
So you're feeling tightness down your posterior chain.
But yeah, like a tiny bit on my back.
Okay.
Not really, though. It's more significant on my legs.
Come back up for me.
Yep.
Now I want you to extend backward the other way, okay? Good. Any low back pain with that? Wow, you're able to go pretty far.
It's tight. It's not really.
It's
like
tight,
a sharp
but it's not no sharp
very
pain.
Dull. Very dull.
Anything down the leg when you extend backwards?
No.
Good, perfect. All right, next I'm going to get you to lay on your back, please.
Great. Facing this way.
Yeah, face up there. Good. I'll move the headpiece up for you.
Great. Thank you.
I think we're able to actually just do this in one long take. This is a good, different room orientation. I like this. All right. Comfortable there?
What's that?
You comfortable there?
Yeah.
Perfect. All right, so you just sit tight. So, as per usual, we're going to get straight into the straight leg raise. That's the first gold standard test that I like to do with pretty much anybody. Now, I know that your symptoms are typically on the left side, so we're going to start on our right. We're going to take this, we're going to keep our knee straight. I'm just going to lift it straight up. You let me know if you get any pain in the back or down the leg.
Yep, right there.
Where do you feel it? Okay, so you're feeling pain limited to the hamstring? That is a very tight hamstring. Holy crap.
Yeah.
Relax for me as best you can.
Okay.
Okay. Any back pain with this?
No.
No? Okay. So we got very, very tight hamstrings. Like that's a rock. I can tell that you've been hitting the gym just a lot. Now we're going to bring this leg up. You let me know any back pain or shooting pain down the leg. Anything?
Yes.
Where?
Shooting pain down the leg, right about there.
Okay. Now is it starting in the back or is it again just limited to that hamstring?
Do that again. Push up, push back. No, it's starting in the leg.
Okay, so again, that's just hamstring tightness once again. All right. So I'm going to bring this up, bend the knee, bend the knee.
Now, as you put that down, I just want to note that I get like a lot of tingling in my feet.
Interesting.
Yeah.
Okay, with both feet or just this one?
This one more so.
So
Yeah,
bringing this up,
As we come back down.
and as I lowered you down. Now I want you to actually lower yourself down.
Sure.
Go ahead, very slowly. Tingling?
Yeah.
Okay. All the way down into like the toe region?
Yeah.
Right, is there a specific toe region?
It's from like the heel. It's the whole foot.
Oh, the entire foot
Yeah.
there. Okay.
Yeah.
Anytime we're dealing with numbness or tingling, it's going to be due to one of two causes. Okay, either a vascular cause or a neurogenic cause. Now, any history of heart disorders or heart disease in either yourself or your family?
I was asking my family that today. No.
No.
Not
Okay.
anything significant.
Okay, so without the history and with having a little bit of the MRI findings suggesting the compressed disc, we can assume or we can proceed thinking that this might be due to a more neurogenic cause, perhaps tension on the nerve roots. Who knows? Well, actually, I kind of do.
Do you think, Adam, though, that maybe perhaps that maybe because my legs are so tight, that this is cutting some circulation in my lower.
Circulation, entirely possible. I see that more frequently with muscular tension actually causing tension on the nerve roots themselves, not located in the back. So, like if you were to have extremely tight muscles in the bottom of your legs here, in your calf group or your quad group, you can absolutely get some sort of radiculopathy-like feelings going down. Like in the forearms, I know there's pronator teres syndrome, which is not super common, but especially with somebody who's doing a lot of wrist movements such as yourself.
Right.
And that's actually my first hypothesis for you, rather than jumping to carpal tunnel syndrome that a lot of people would assume just because you're feeling like some pains in the wrist, right? So it's a possibility, but again, knowing what's going on in your back, that's kind of where my head's going to first, and if we don't see any improvement addressing that, then I can also look to everything else down the chain, right?
Okay.
Did that answer your question?
That does.
Perfect.
Thank
Okay.
you.
Now, let's bring this up. I'm going to get you to bend your knee for me. Bend and bend. Good. I'm going to place my hand behind your SI. And I'm going to just push down through. That's okay?
That's fine.
Good. And same deal here. Going to bring this up. Going to roll this over, and I'm going to push right through. That's okay?
That's good.
Good. Okay. Awesome. So, next up, I am going to get you to go on your front. Okay?
Sure.
My hands are coming in on your back now, okay?
Great.
All right, so. So one of the first things I'm noticing when feeling Freddie's upper back is that he's quite tense, and a little nodule there, but he's quite tense. And that's quite common anytime I treat somebody who has the combination of physical fitness, okay, whether that's resistance training or some more intense sport, alongside having a physically intense job. You're going to end up getting a lot of this tension, especially up in this region. Mm-hmm. Would you agree with that? Because, I mean, you haven't felt many backs, but this feels quite athletic yet stiff still.
Yeah, I mean, I'm constantly, we are constantly, with the nature of our job, we are constantly using our shoulders, putting, wiping stuff down all the time, so hands and legs are always in motion. Mm-hmm. And when you mix that in with extended 12-hour-long days, 4 days in a row.
Of course.
Doesn't number on you. So that's pretty tight too at the bottom.
Yeah, down low in the back. Now we're getting into kind of the primary site of complaint here, and we're feeling just as tight down the lumbar erectors as we are down the thoracic erectors. Again, our erector spinae are the muscles that literally help us to stand upright and exist on the spine. So left side is where we're seeing the complaint the most. How's when I press right in there?
Sharp pain.
Sharp pain where?
Where your fingers.
Just limited there, or do you get anything down here?
A little bit.
A little bit down here?
Try that again.
Okay, we're going in again, pressing at about maybe 6 or 7. You're getting it down here?
Really, yes.
Okay. Now, let's compare that to this side. And that's the same amount of pressure?
That one's not as evident.
You're not getting anything, huh?
No.
Or, well, maybe you are, but it's a decrease.
It might be like a tenth of the other side.
Okay, all right. So we're noticing when we do press right on that side of that site of offense, we are getting a little bit of a radiculopathy-like sensation down to the glute and to the top of the hamstring, as Freddie said. So that's kind of in line with what we are reading on the MRI report, suggesting the compression of the disc. So. Alright, gonna feel through the gluteal muscles now, okay?
Sure. Yep.
So, glute med exists kind of in this lunar-like formation, so we'll go through here. Okay, piriformis off the sacrum, over to the greater trochanter. Any tenderness through this region? Doesn't feel super bad. Feels okay to me, but what do you feel?
Nothing significant.
Okay, good.
Yeah.
So now we'll do the other glute med.
That's sharp pain right there.
Sharp pain there?
A little bit, yep.
Tender? Okay. Alright. Is that okay?
Yeah, do you feel that shift there, that pop?
Yeah, there was a teeny little release there, completely unintentional, but hey, we'll take it.
No worries.
Now we'll do this side. That's...
Yeah.
The SIs feel okay. It's really all
it does
limited to there.
It does. That pain we were talking about down the leg when you were pinching the bottom left side
here?
there.
Yep.
Yeah, as you were pushing down with both hands just now, I was feeling that again down the left leg.
Feeling that again, okay. So pushing down on the SI forces us into a little bit more extension, so I would actually say that we're getting some extension intolerance on this left side. So let's do another test here. I'm going to actually lift this leg up while I pin down this SI. Is that okay?
Yeah, I do feel some stuff though.
Okay.
Yeah, I mean, it's fine. I'm just like saying it for the camera and stuff.
Yeah, no, that's
so
good.
So that our viewers...
All right, so you're firing on as I lift this up. Was that uncomfortable, or are you just kind of doing that reactionary?
I'm not sure.
Okay. All right, so camera can see that. As I lift, his entire glutes just fire right on in a protective mechanism. Okay, so how long you've been dealing with this for again?
I would say minimum a year and a half,
Minimum
but I
year and a
started
half.
feeling it a lot more in February this year.
Okay, February this year.
So it should be in 6 months ago.
So to me, it looks like Freddie's body is kind of adapted to be very defensive around this region. Okay, because any kind of movement that's unexpected, everything fires on and try to keep everything real still. And that's understandable because if we get excessive motion, as I'm inducing, we're getting that radiation down the leg here. And that's not necessarily a pleasant feeling. However, movement is also conducive to healing. All right, so it's a little counterintuitive. We need to be able to move freely in order to bring in additional blood, additional nutrients to better restore the tissues that are underlying or the tissues that are existing there. So today I'm going to be treating you with SMT, which is the adjusting of the cracking that you're probably familiar that chiros do, alongside some massage, and then there is it's called nerve flossing, right? This is a technique that I'm going to show you that literally will help you to quote-unquote floss the sciatic nerve and the lumbar plexus and everything coming out of this region back and forth, which should help with mobility to therefore decrease the frequency of getting that radiating pain. Does that sound good?
That sounds great.
Perfect. That's what we're going to do today, all right? So I think Freddie might be a little bit of a challenge to try to get through all of the guarding that we have up here, because he is definitely a muscular dude. So this is just going to be interesting to see. Oh, there we go. Got a little release right there for free that I wasn't even really trying for. So maybe not. Maybe I just made all that up for content. Who knows? All right. So I'm going to get you to take a big breath in for me, Freddie. And all the way out. There we go. In. And all the way out. Good. Very good. That wasn't bad at all.
Pretty good.
Yeah. All right. You're going to rotate your head. You just breathe normal. Okay, that's stubborn up there, but that's okay. You okay?
Yep.
Good. I'm going to come around. All right. And I'm just going to rotate your head just like so, just like so. There we go. Good. So that's through the thoracic spine. Now let's work down into some lumbar mobilization. So once again, mobilizing, it's an osteopathic technique, just designed to really kind of move the tissues around and calm them down a bit. So we're going to start on the right side.
Super tight, eh?
Yeah, just a lot. Does it feel okay?
Yeah.
Okay. If you get any of that stuff down the leg, I know that's for the left side, but if that starts happening, you let me know. I'll go lighter, okay?
Okay.
That's not the intent. Hand's going to go on the front of your hip there.
So it's just a sharp pain down, like.
You're really still getting that down.
Yeah. No. It's actually like right here.
Staying very local.
Yeah.
Okay. Interesting.
And it's Yeah, it's pretty sharp. I would say.
Now were you feeling that when I was doing this one?
No.
No? Okay, we're going to just stick with this one then. I don't want to aggravate that more. Okay. Good. All right. So, Freddie, we're going to go for that segment now that we were seeing on the MRI. Okay, we're going to go for just above it and for just below it. So let's see what we can work with. Now, you're in the right position here. Okay, I'm going to take contact. Ooh, right there, nice little prominence. All right, I want you to take a big breath in and all the way out and just relax for me. Oh, how was that?
It's good.
It's good?
I haven't had that in a while, so.
There you go. So that was a little bit quieter, but we're also going very gentle considering we do have a little bit of underlying stuff going on. So we don't want to be slamming as hard as we can on the first go. You can always add more force. You can't take some away. But overall, that seems like it's a pretty good response. Yep. Let's get you on your other side. All right, so breath in And all the way out, all the way out. Good. Good. Okay.
That was great.
So Freddie has got some tension kind of right, well, he has tension throughout, but he's got it worse right at the top. In my opinion, worse on the left side. So that coincides with headaches, which again, definitely probably have a dehydration component to them, but I don't think that his stressful job, running his own business alongside it being physically intense, is doing him any huge favors in that department either. So we can treat that. And I can also advise that he drink more water, which is something that probably everybody should do. So hydration check, everybody watching. Okay.
I'm good.
So have you had your neck adjusted before? I know you've seen other chiros. Do they ever work on your neck or no?
Yeah.
Okay.
Yeah, I have. It just has been quite a bit of time.
It's always a while to
It's
just
tight,
confirm.
isn't it?
It's quite tight, man.
Like on a scale, 10.
Well, I mean, it's hard because every individual neck is different, so I
yeah.
don't know what your scale of 1 to 10 actually is. But
that
like
makes
in
sense.
my experience, I'd say that this is probably like 6.5, 7. Like the worst neck I've ever felt being like 10, and that person literally had fused vertebrae. But like you don't have fused vertebrae. No,
Okay,
like
so
you just have tight muscles.
Factor that in.
Yeah.
So I'm actually getting it's weird because right now I'm getting a feeling down my, like kind of down my leg a little bit. I don't know if that's connected in any way.
Feeling in the leg?
Not right now.
Feeling
It's
in
more
the leg?
so. No.
It's more when I'm putting pressure here.
Yeah, on the right side.
And you're feeling it
Yeah, right there.
right there. You're feeling that in the lower.
Yeah.
Okay. So I always love when patients mention this because on the surface, it's like, what the hell is that? That doesn't make any sense there.
Yeah.
You're feeling it down to the low back, you said?
Yes.
Okay.
Down lower back. It's almost like the center of my leg going down.
Down into the leg even?
Yes.
Okay, on the right side. So
On the
left
left
side,
side,
excuse
yeah.
me. Okay, so once again, that's the side that's affected. So we have to consider that you've got a little bit of different anatomy going around anyways. But why is it that that segment is getting irritated, causing the leg stuff going down when I move the neck? And that's because of a long-ass muscle called your multifidus. Okay, your multifidus connects from literally the very, well, actually it's two potentials, but we'll start with the multifidus. The multifidus is up here, okay, and it goes all the way down our entire spine, connects basically encapsulating our sacrum, okay, which is part of the L5-S1 joint complex that's already a little bit compromised on that side. So if we're creating tension on that by doing this movement, it's entirely possible that we're pulling all the way down there, and then we're getting symptomatology appearing down the leg. The other thing, and this is actually kind of in line with the nerve flossing that I'm going to be teaching you in a little bit too, is that the sciatic nerve, which is the largest nerve in our body and the one that everybody worries about when you hear the term sciatica going down the leg, it does connect all the way to our brain, okay? Because the sciatic nerve connects to the spinal cord, and the spinal cord obviously is just an extension of our brain. Okay?
Wow.
So in moving it this way, it's also possible that you have just straight nerve root tension somewhere along the chain for which the flossing is intended to help relieve. So I'll show you that after I'm done with this, okay?
Thanks.
So two possible mechanisms there.
Yeah.
Okay, now I'm going to get you to turn your head as far as you can to the left for me, please. Good, and now I want you to drop your head into my hand. Good. Don't push, just drop. Give me the weight. Good. Awesome. There we go. So we got the very top there, and then there were a few more segments lower down that I didn't want to just let walk out of here. So, how was that? You okay?
That's great, yeah.
Good. actually going to move the microphone.
Wow.
Alright, so the microphone's moved. And I'm going to get you to turn your head as far as you can to the left, please.
To the right, you mean?
To the right, yes. He's paying attention more than I am today, yeah. All right.
Deep breath?
Good. No breath. It doesn't worry. Lungs aren't up in the neck. Good. All right, there's one hidden there. One more adjustment that I want to try, just like for your own sake, is for that very top up there. So I'm actually going to get you to turn to the left once again, please. Good, and then just keep that head relaxed best you can. There we go, got it. All right, we'll get you shirt off, face down.
Great.
You know, one of the biggest things that I've changed about myself in the last year that I've consciously been very mindful about is who I surround myself with too.
Mm-hmm.
Yes.
I've been very mindful about, existing relationships that I might have had a year and a half, 2 years ago, and I'm like, does this bring me value? Is this helping me become a better person?
Get to where you want to be, right?
Achieve the goals that I'm, aspiring to achieve. And it's like, some of them are not, and it's a hard pill to swallow, but you have to be mindful of that because you only have a finite amount of time. The biggest thing that we do to our clients is we save them time. Time is the most valuable resource of all time. Like, I mean, if you think about it, like Bill Gates, what's the one thing he can't buy?
Time.
Is time. Do you know what I mean? So if we can, I know you can't buy time, but if you can achieve, you can purchase a service that helps save you time. That's the next best thing.
Mm-hmm.
So that's kind of like our whole thing. And on the same note of time being a finite resource, you have to be very wise with who you spend your time with. So that's kind of like my philosophy on that.
Next time I'm kind of debating with my girlfriend whether or not we hire a cleaning service, I want you to come to the table. Okay? Because I want to save my weekends.
Yeah, no kidding. Honestly. I mean, that's why they're there. That's why they do well.
I couldn't agree more. Like, you don't get time back, and it is important. It's been a big theme of just kind of my life lately, I feel. But anyways, now that we're doing this, I'm going to ask you the question that I usually ask people while I'm doing this.
Sure.
Obviously, you are a car details guy, hence the detail on your car that says detail guys right outside my window there.
Yes,
But what do you find most rewarding about your job, unless you kind of just answered that in the saving people time aspect?
Well, yeah, actually, there's a few different components. So first and foremost, as a business owner, achieving purpose, finding your purpose and striving to achieve it in itself, you're constantly solving problems, and that keeps me stimulated. So that's very rewarding. But the other side of that, the customer service side of it, is making people really happy. I'm a people pleaser by nature, so I feel happy when I can make my clients and people around me happy. There's a good and bad side to that coin, right? Because on one side, you are working hard to achieve, help people get happy, but then the other side of that is, well, it can be potentially draining. So, the part that I like the most, though, but if you do make people happy, it's extremely rewarding. So, that is, I would say, one of the best parts about what we do is giving people like the new car experience, making them super happy when we give them their keys back, and that in turn makes us feel very accomplished throughout the day. So it really is quite, it's very rewarding.
Good.
I enjoy it very much.
Happy to hear it. I mean, everybody likes being happy, and making other people happy is actually, there are studies to prove that that can help to lift people out of some pretty serious mental funks, where if you know that you are responsible, or that the actions that you took directly help to influence the positivity brought into somebody else's life, that's powerfully beneficial to yourself too.
I would agree.
So I completely understand that, and I feel kind of similar when I got people who come in here crying and then they leave crying for happy reasons, as opposed to I can't move straight. So fully get you, man. Thanks for answering that one.
Of course. Thank you, Adam.
as we were talking about earlier, when I was moving Freddie's neck around, he said that he was feeling some pain and discomfort, actually all the way down to his leg. So I mentioned earlier there's two different mechanisms that could explain that. Number one, we are lengthening and applying tension to the multifidus muscle, which in turn could then pull on that site of effect within the L5S1 region, in turn then causing the symptoms down the leg. Or it's the sciatic nerve itself, which connects all the way from the top of our brain. Okay, all the nerves throughout our bodies, even the ones in the toes, all start from our brain, all the way down the spinal cord, out through the foramen there, and then into the leg as well. So if it is that cause, if it is the sciatic nerve root, what we need to do is something known as nerve flossing, or specifically sciatic nerve flossing. Now it sounds kind of complicated, it's actually quite simple, and it works simply as well as the name would imply, given that it's a floss technique. You're going to be sliding the nerve back and forth from the top of the brain all the way down its entire pathway to try to mobilize it and restore proper motion or less catching, which then in turn will be perceived by less frequent pain in that region through the neck movements we were doing. So the way that we're going to do that, it's quite simple. Okay, we're going to start, and I'm a little bit cut off here, but I'll try to do what I can here. Freddie's going to be able to do it. We didn't have the mic in the way. We're going to start just with our chin kind of tucked to our chest. Okay, and what we're going to do from here is at the same time, we're going to, on the affected side, we're going to straighten this knee.
Okay.
And we're also going to bring our head all the way up, and we're going to bring our toes up towards our knee as well, okay?
Good stuff.
And then we're going to bring it back down, just like so. And that's just the movement. That's all it is, okay? That in itself is going to slide the sciatic nerve up and then slide it back down, okay? So for you, I'll move the mic just a bit so you don't nick it there.
Sure.
But I want you to try that same movement, okay? So leg, you're starting with your chin down,
Yep.
and then you're going to bring your left leg up and your head back at the same time, and then toes back towards the knee. Now, are you getting any tension when you do that?
Yeah.
Yeah, okay.
Definitely.
So somebody who's asymptomatic and doesn't have sciatic nerve tension, not going to have any problem doing this, okay? But somebody who does have it, you're probably going to get some mild reproduction of that pain. So I don't want you to push past the point of extreme discomfort.
Okay,
Okay?
sure.
I want you to try to keep it underneath a 3, if that's possible, on a scale of 1 to 10. Okay? So what's that
That's
at?
it. Hold on.
Higher than a 3?
Hold on a second.
Yeah, nice and slow, very slow, very slow. Okay, this isn't a fast movement. You're doing it just fine. Yeah.
That's probably good there, yeah.
Yeah, okay, so what is that at on a scale of 1 to 10?
Probably a 3.
Probably a 3?
To be fair,
okay.
yeah.
So I say with all my patients, it's almost become a bit of a joke, if you want to make an omelet, you got to crack some eggs. So I'm not afraid to induce a little bit of pain in my patient base, but you always want to try to keep it under a 3 whenever possible. And in some extreme cases, I'll say under a 5, but that's rare and in between, and you definitely need a diagnostician's or a clinician's opinion on that one. So Freddie,
Good.
on any particular day that you're getting some really bad pain down that leg, or for whatever reason this complaint is really flared up, I want you to try to do this nerve flossing basically as much as you need to until you notice that the discomfort starts to come back down. Okay,
Huh.
so this.
Given it having the term flossing,
Yeah.
I do that regularly. So
Do you? Because I just started doing that
Oh,
regularly
dude, it's like
myself.
crazy.
I was disgusting before this.
Oh, dude,
right?
yeah,
So-
no. Flossing is like extremely. Yeah,
Yeah.
no. I floss like, once, twice a day.
You can do this daily, then, if that's
Right.
the case. Okay, you can do
Okay.
maybe like 10 repetitions daily, and that's
Right.
only going to help you further get through the days.
Right.
Okay, there you
Okay.
go.
Good stuff.
Any other questions? No.
I don't think so.
Okay, good.
Yeah.
Thanks for coming in today, Freddie.
Of course.
How did you find all of that? Do you feel like you kind of got value in coming in, or?
Yeah. Well, first off, thanks for having me.
Of course, of course.
Yeah. So given the lifestyle that I've been living in the last year and a half, 2 years since starting the business, it has been intense and very limited on time.
Mm-hmm.
And for that reason, I have also, it's one of the reasons I haven't been going to the chiropractor for long, regularly.
Mm-hmm.
So this being my first session in nearly 2 years, I would say that this was a very beneficial, not just on the side of things, not just on the actual like being here, but also the taking the time of making this video and going over informative facts throughout your operation, throughout your process and procedure, has added a lot more value to the overall service. So I do have to thank you again, not just for being here, but also for taking the time to go through that.
Thank you so much, Freddie.
Yeah, of course, man. It's almost like that analogy, catch a boy a fish, teach a boy to fish. Like you feed him for a lifetime versus you feed him for one meal.
Yeah.
So going over and teaching people, your clients, your viewers, the informative facts that you're sharing helps them live an overall better life.
So it's really funny that you say that specifically, because that's actually a core tenet of what's being taught right now to at least most of the Canadian chiropractors within their curriculum, is this idea of patient empowerment, for which a very important concept is patient education, right? You want the individual in the room to be able to go and promote their own health, and the only way they're going to be able to do that is if they have a firmer understanding of what's going on. Okay, so as you guys would know on the channel, like, I try to differentiate myself by being as educational and talking quite a bit. So it's good to hear that the patients enjoy that as well, because if they didn't, there'd be a serious problem.
Yeah.
But so thanks for coming in again, Freddie. Really appreciate it. We can end on a high five. Oh, that sucked. There we go.
Thanks, dude. Don't forget to like, comment, and subscribe.
Thank you, Freddie.